Okay, we are trying this again. We'll see. We're having technical difficulties. Trying to do an Instagram live with my amazing friend Bryn. Who let's see if she can join. Okay, Bryn, I see that you're here. Let's see if it will allow you to actually co-host with me. Yay!
All right. Hi.
Yay!
Yeah, I'm not really good at this Instagram stuff, so I'm glad you're better.
I'm not. Technology hates me, so I accept this fully as my fault. So welcome. The point of this Instagram live today is that we are talking about a new option for virtual pelvic floor physical therapy that Intimate Rose is offering. Um, and I think it needs some explanation because I could see how that could be a little seem a little wild or confusing to people. So go ahead and introduce yourself. Tell us who you are.
Okay, I'm Bryn Zolty. Been a pelvic PT for a long time. I have several board certifications in this field. Very passionate about it. I teach. I help run a residency. Uh, and I work in clinic in Loveland, Colorado, and I also do telehealth. So it's a really great mix of being able to have hands-on and also work hands-off.
I love that. No, Bryn has amazing experience. She used to live near me and then very rudely moved across the country. So I will take her in any form that I can get her. So let's get into this for people who have no idea what the heck is pelvic floor physical therapy.
Yeah, so it's a very specialized form of physical therapy. So we can treat the whole body, and we should, even though we're looking at things going on in the pelvis. But we have special training to evaluate and treat the muscles, soft tissues in the pelvic floor, in the abdomen, really deep in the hip. So these muscles play a role in sexual function, urinary bowel continence, constipation, cord strength, pregnancy postpartum, surrounding prostate issues, organ support. I'm sure I'm forgetting something, but all of those things, all ages, all genders.
That's awesome. So, all right, here's my question. If you're in clinic, it'd be, in a private room one-on-one. Someone's doing this, I would think their first question would be, do I have to show my hoo-ha on camera to you?
Uh, the answer is no. That's not a requirement. So I have over the years doing this a long time, gotten some pretty intimate pictures sent to me, but this
Yes.
is never required. And so we'll talk you through what you're comfortable. So for some people, they might try different movements. They might sit on their hand fully clothed. I might have them roll up a towel and lean on the different muscle groups, talk them through it. Most often, I have people evaluate their own pelvic floors. So I'll give them instruction and follow up with whatever instructions they're comfortable with. I've got PowerPoints, I've got handouts, I've got videos, and I might give them a list of, let's say, 5 things I want you to feel or try to figure out in your pelvic floor. And then I'll have them message me or we'll talk about it next visit. So no who has on camera. I'm really spoiled because your patients will call me and be like, Andrea Martin said it's this muscle. My bulbar cavernosus is tight. So that makes it kind of easy. Or a lot of times I get people who have been in client PT and they didn't get the results they want or couldn't make the schedules work. They couldn't get the babysitter
Yep.
or they're 6 months out. So they'll call me and say, they said I'm tight. They said I'm weak. But it really, we can figure that out based a lot on your symptoms or self-evaluation. Yeah.
Which I think is so amazing. Like if you remember during COVID, there was memes going around and jokes about like, your gynecologic visit in 2020, and it's like, picture of someone's underwear on the floor. And so like to get to this point now where we can actually do this and actually help people virtually, I think is really cool. Here's my question to you, and I guess you kind of started to answer this. If I'm a patient, how can you help me if you can't touch me?
So symptoms give away a lot. Um, Intimate Rose really has hired a lot of very knowledgeable, very experienced PT, so that helps us a lot. Have you self-evaluate and give me some information. Session always begins with detailed history, your symptoms, intensity, what you've done so far, previous treatments. It's telehealth, so we're going to have you move around a little bit. We're going to look at your back mobility, your hip mobility, functional movements. Your hip muscles, your hip rotators are attached to your pelvic floor. So do a lot of looking at what those muscles are doing functionally and just range of motion. As pelvic PT, we treat a lot of urinary and bowel symptoms. So I can give you a bowel or bladder diary, you fill it out. We can do so much for urgency, frequency, urge incontinence through behavioral and education. Um, we can do a ton. Yes, absolutely. Of treatment and evaluating just through the telehealth. Uh,
Is
what else?
there is there any specific type of patient that you might be like, you know what, this may not be the best modality for you. This may not be the best option.
Uh, if we're not making the gains we'd like, or depending on someone's comfort level with treatments, sometimes I might in clinic get someone that is there for something like we need a pessary fitted, or we need to do rectal balloons for rectal sensation. So things along those lines should really be in clinic, or if we start identifying that you would benefit from hands-on, we'll help you find someone. But let's say you call that therapist and like, all right, I have constipation and I need all these treatments, and they say I'll see you in 6 months. Well, you should come start with us. We'll do everything else. So you start feeling better, getting better, and then when that in clinic has availability, I'll absolutely hop on in. And then you can see what works for you if you continue in clinic or in person.
Yeah, I have to say the more, at first when I think you first introduced me to the idea of virtual pelvic floor physical therapy, and I was like, but I trusted it because it was you, and I was like, well, if anybody could do it, Bryn can do it. And I have to say, the more I have been open to this, I can't tell you how many groups and types of patients that I've been like, oh my God, this would be perfect for you. The people who have no transportation, who have transportation issues, that, again, like caregivers, childcare, can't get anybody at home. Or even like I had a patient recently, her husband had a stroke and he's doing well and she's ready to start taking care of herself. But she was like, I'm not quite ready to leave him on his own yet, but
Mhm.
really wants to start working on her own progress. Even where I am, there's a lot of pelvic floor physical therapists around here, but there's still a wait to get in. So it's nice to have this option and be like, I'm getting started. I don't want to wait till July or August, 2 or 3 months down the road to do this. And I also had a patient, I think it was yesterday or the day before, who is really, really scared and very painful and hesitant. And I guided her. She did her whole exam. I barely touched her because that made her more comfortable. And introducing the idea of pelvic therapy, I saw her eyes like, "Ah." And we were talking about it, and I said, wait a second, I have an idea. I was like, would this make you feel better if the pelvic floor physical therapist literally could not touch you because they're in another state? And she was like, yes. How does that work? So, in that situation, I think it would be such a good thing for her to be, in the comfort of her own home in this situation where obviously a pelvic floor physical therapist, you're never going to touch someone without their consent, but she has that additional kind of mental comfort of knowing like this can't go anywhere else. Like I get to direct this care.
Yeah,
So,
yeah. And even in clinic, I have people come in and they are teach me what to do. Even the people that I do a ton of manual therapy. At my current clinic, an hour and a half long appointments. We do a ton of manual therapy. I love it. But I teach everyone how to do their own because you're going to get better very quickly if you can do this on your own as well. So it doesn't matter. Telehealth in person. I'm teaching everyone how to evaluate and treat their own pelvic floor, and I should be teaching every woman this. So they know when one side's feeling tight or if some pain starts happening, they know how to check their own pelvic floor, which really can help them calm down and see that maybe this is muscular. So we don't have all these alarms go off because we automatically think something's wrong with our organs. And this, being able to self-treat is so empowering.
Yeah,
We should be empowering everyone.
it
Yeah.
it really is, and it's nice to kind of, you know, it's two people involved. It's not just you being like, I'm doing this. This sort of it's more involved, and like you said, it's so empowering for a patient to be able to be like, you know what, I know what this is now, and I have the tools to treat it, and I'm going to do it on my own. So I think that's really cool. So I'm in, obviously, I only work with women. So do you treat men as well? Are you guys treating men, or is this just for women?
Yeah. Men have pelvic floors and they can leak urine. They can have diastasis. They have a lot of pelvic PT needs surrounding prostate surgeries. So yeah, absolutely. We can treat men. Uh,
Okay.
100% recommend it. And I usually, they are going to be in need of some tools to help them stretch their pelvic floor, just
Sure.
because of the logistics of it. And intimate rose wands are my favorite, especially for men. Yeah.
Absolutely. No, I love them too. So basically, if you have a pelvic floor, you can help them.
Yes. Intimate rose makes this so easy, especially because it's a cash-based service. You're not going to fill out 20 pages of insurance information and surveys. You literally just go to the website, click make a telehealth. They'll give you a symptom form to fill out. You can pick your PT if there's multiple in that state. And then your PT helps you all the way through. Uh, each state might have different guidelines or different rules, so the PT will make sure that to take care of all of those. So it's really nice. It's so easy.
Yeah.
We can focus on whatever you want during the session. Um, I really like it as a
Yeah.
practitioner. I really
Good.
like it. Yeah.
Say if I was a patient and there's multiple PTs available in my state and I started with one person, can I stick with them throughout the whole time? Am I going to be like bounced around to different people? What's the
Um,
story there?
uh, I I think all of us would recommend you stay with someone if you like working with them and you're comfortable. So you should absolutely, you make the appointment, you pick the PT, you won't be bounced around. And definitely a theme that I've seen a lot in talking with the other therapists working with Intimate Rose is, I know if I don't have the exact availability you need, but you contact me, we can make that work because with telehealth, it's so easy. It can be playing upstairs with the dog and I can go into the office and do it. So there's a lot of flexibility
Yeah.
within the therapists. We really want to make sure you get seen.
And that flexibility is just not really there in most, physical PT offices. It's hard. Like physical therapists want to live their lives too. We all, you work at the time when everyone else is at work. So it's really hard if you're a patient to be like, all right, it's 7 o'clock. I'm available now. And it's like, well, the PT
Yeah.
office is closed. So again, like having access to someone who might be in a different time zone, which then now works out for, where you live today, that you can actually get access to physical therapy is huge because I mean that's the problem we all run into. Office hours, well, we're all at work. So how are we supposed to get to our appointments?
Uh, Especially because I'm in the middle of the country. I think I have 12 different licenses in different states. So I love it. Your clients they're off work at 5 or 6 and I'm still daytime hours. So they're 5 o'clock, my 3. It's great. Let's have an appointment.
Yeah,
Yeah.
it
Or
works out for everybody.
yeah, Sunday evening, I'm not going into the office, but if you need a 45-minute appointment, I'm happy to do it.
Yeah,
Yeah.
absolutely. It's a lot easier that way. Um, how how does this work? So they sign up with you and you have your initial evaluation. Is that you know, is that any longer than the subsequent appointments? Are they all the same length? How often do they do this?
Uh,
How does that generally
yeah.
work?
Right now we're doing 45-minute appointments, and uh, I think that's a great time length to start with. So we can discuss everything, evaluate, and give you something to start with. And then frequency is really between you and your therapist. So ideally, PTs like to see their clients and patients every week, but uh, if it's not working or we're doing a treatment that will take longer to work, we can really be flexible. So some people every 2 week works for their schedule. If they're really good at self-treating and then we're just making adjustments, I would spread out the time between them. But normally after the first visit, it's good to try to get another visit kind of short after. But uh, I use messaging. So usually the day after an appointment, I get a bunch of messages saying, hey, this was great. Can you clarify this? I've started this, or here's the answers to the questions you asked me to check in my pelvic floor. So I do like to keep in touch, even if it's a quick
Yeah,
message.
I love that it's not just saw you, you're done, you're on your own until your next visit. Good luck. So I think that's great. Um, what else do I want to ask you? I guess is do you have favorite types of things that you like to treat?
Oh, I don't know. I like everything. So I definitely I like everything. The urinary
Sure.
leaking, emergency, all that stuff. I like because we can treat it so quickly. Pelvic pain, and helping someone being able to have intimacy pain free is so rewarding.
Yes.
Um, I love treating constipation. It's so mechanical, and when you teach someone, it works so well.
Hmm.
Here in Colorado, I do a ton of pregnancy and postpartum, and I like working with the pregnant mommies. So, I guess through the years, I've had my favorites, but now
Yeah,
I just like
you're well
everything.
you're
That's
well versed in
so good.
everything.
Yeah.
That's another population. I do work with some pregnant and postpartum patients, but not a ton. But that's another population that I think of like, God, how you have a baby, you're breastfeeding, you've got this little baby infant, and now it's like head off to your pelvic floor physical therapy appointment. Hell of a lot easier to do when you can do it from the comfort of your own home.
Yeah. Yeah, and it's the same thing. We teach them how to mobilize their pelvic floors, different movements for different stages of labor and delivery, and knowing how to hold your pelvic floor, or sometimes we call it pushing. Some people don't like to call it pushing. As a very holistic world out here. Um, so facilitating delivering of a baby, knowing your physicians, knowing what to do is so helpful to reduce injury, to help the delivery go smoothly. The more you know going in, the more comfortable you are if things don't go exactly as planned. So um, it's really nice to work with.
Yeah, I think people sometimes think pelvic floor physical therapy of like or medicine in general in this country of like you wait until something happens and then you treat it. But there's so much you can use this for as like preventative medicine, which how wonderful is that?
Oh my goodness. Yeah, or yeah, so so many people are told you can't go lift weights and exercise anymore if you have a prolapse. And we can do so much of that via telehealth. We'll teach you how to lift weights and how to help your pelvic floor support you. No one should stop exercising. So, oh yeah, telehealth's a great platform.
It is. No, I love that. I used to be one of those people back in the day for patients after prolapse surgery that I was like, you're never allowed to lift more than this
Mhm.
certain weight ever again. And thankfully, I have learned from those past mistakes because we got to take care of the rest of your body. And there's, effective ways to do that and protect your pelvic floor at the same time.
Yeah,
Yeah.
yeah, absolutely. It's very fun to get people moving again.
So let's talk about cost because that's what I would want to know. That's what this all comes down to. Can I afford this?
that So I would definitely, if you're thinking about it, do it now because right now they're offering quite a discount. So, and it says it on the top of their website, the appointment's $99. And because we're getting up and running and started with this
Yeah.
program, so definitely make it now. But it's not like waiting for your insurance bill going, how much is my 80/20 or my
Yes.
70/30? You know what it costs, that's all it costs. And that makes it really nice and easy. We don't have to cater to an insurance company. We can really just do what we think needs to be done, or what do you want during that appointment? I'm
Hmm.
happy to facilitate that.
Yeah. I think sometimes patients aren't even aware of how much insurance dictates what we do, when we do, how we do it.
Mhm.
And to kind of just cut out that middleman and be able to be like, we're doing this because it is the best for you at this time is a really amazing thing.
And that paperwork burden, I was in
I
the
know.
institute for a very long time, and by the time I was on our paperwork, we barely had any time left.
Yep.
I'm now in an out-of-network, in-person clinic and telehealth, and it's people are not as angry when they finally get to you because they didn't
I
get to
know.
do their everything over and over again. So it's really nice. It is
It
nice.
is. It is. I had, I think, two patients over the past 2 weeks. One has insurance, but she was like, my insurance sucks. So let me find out what is my copay even for pelvic floor physical therapy. It was like $300 a visit. I was like, that is unattainable. So I was like, well, have I got a better option for you? And another patient who has no insurance. So, here's her option. It's just, I think it's all about access. Not every option that's out there is perfect for every person, but we should still be offering it to people. Like patients get to decide what's best for them. And
Mhm.
I always say like I can prescribe anything, I can recommend anything, but I'm not the person that has to go home and do it. The patient is. So it's easy for me to say, like, you need to go to physical therapy to this specific office once a week, twice a week, blah, blah, blah. But I'm not the one arranging childcare and paying for gas and tolls and, all the things. So I just love that this is a great option for patients so that they can actually get to physical therapy and get this done on their own time.
Yeah, I've had clients that would drive 1, 2, 3 hours when I was in New Jersey to come see me. I mean, now they do. Some come from Nebraska to Colorado just because access to care, there's not a lot near them, or that person doesn't have the skill set they need.
Mhm.
And imagine someone with pelvic pain with sitting, driving 2 hours to see you to relieve their
That was
pain to
my
go 2
first
hours
thought.
home.
I was like,
Yeah.
everything's probably undone on the way home on that drive home.
Yeah, or the stress of driving through traffic in New Jersey,
Ugh.
all the construction. Oh my goodness. So people would get there and be running late, be stressed out,
Yeah,
and you just turn
yeah.
on your computer and
Easy
you click
peasy.
my link. Yeah, so easy. And people always apologize. Oh, my dog, my kids. I don't mind at all, right? This is your time. No problem. Don't worry about me. And I always send handouts or videos. A lot of times, videos, people prefer them because I know if you have a little person jumping up and down on you the whole time, it's probably to retain everything. But we'll make sure you get the information.
I love that. I love that. You know, that's another thing. Women are usually the primary caregiver, and they're supposed to be, also we're like, take care of yourself. And then you go to these appointments and you can't find anyone to watch your kid. And if you bring your child, it's kind of looked down upon. Like, we don't allow children here, or they have to be in the room with you. And so we've just made it so unfair. And I love how open you are to that. And like, yeah, I get what real life is like.
Dogs and kids are cute. I
I
don't mind.
know. I know. I get so excited when they pop on telemedicine. I'm always like, flip your camera around. Who is
Yeah.
that?
And it also lets us see your home and see you moving around in it. So then you can say, here, look, I have these three things. I have a TheraBand, I have a ball, and I have one weight. I'm like, great, we'll come up with something. So a lot of times in clinic, we use all this fancy equipment. We have a reformer in our clinic. You don't have those at home.
Mm-mm.
So definitely being able to see what you're working with, we
Yeah,
can make it work for you.
I love it. All
Yeah.
right, so how do people do this? If I can remember correctly, because I've been showing people this, you go to intimaterose.com, and then at the top there's a little thing that says telehealth, and there's three options. I think the bottom one says like virtual pelvic therapy or something to that extent.
Yeah.
And you can sign up there, right?
Yeah. And they'll help you with any help you need. And once you get an appointment with the PT, they'll help you with anything you need specific to you or your state.
Love
So
it.
it is so easy. Yeah.
Yeah, it is. We love easy. We're all stressed out. We want easy.
Um, well, I told
Yeah.
you, we need more practitioners out here.
Yeah. You're close. You were close to luring me in.
I'll keep trying. Definitely.
Just
Um,
show me pictures of dogs, and I'm like, okay, I'll go.
Rocky Mountains, it works out
What
here.
more could you want? So, anything else you wanted to throw out there into the atmosphere, let people know before I let you go and be on your way?
No, I guess just also letting not just potential patients, but practitioners like yourself know that if you're finding, they're coming back again and again, I'm still waiting, I can't get in, or I'm in a really rural area, definitely contact us so we can start helping. And I love contact between practitioners too.
Mm-hmm.
Obviously, we talk all the time. I love to know what's going on or what you see going on, and then we can compare notes
Yep.
and find out the
Yep.
best way to help them.
Yep.
Yeah, so absolutely, absolutely reach out.
Yeah. I love it. So wonderful. So I don't think I see any questions in here today, but at any point, if anybody has any questions, we'll post this. You can comment there. You can send us messages through Instagram, wherever. We're happy to hear from you. And thank you for anyone who's joined. And thank you, Bryn. I always love hearing all you have such an intelligent brain. And I've said this before. I just want to like open your skull and crawl inside and learn all the things. It's not creepy, is it?
Uh, no, not at all. And I very much appreciate you taking on my questions about hormones and patient symptoms. I think it's a two-way street here.
Any day, I always love to talk about hormones. So, all
Mhm.
right. Well, thank you so much and have a wonderful rest of your day.
All right, you too, Andrea. Bye.
Bye bye.